My name is Jelena Dzankic, and I'm part-time professor at the Global Governance Program at the Schumann Center and co-director of the Global Citizenship Observatory. When in early March this year, the World Health Organization declared a COVID-19 global pandemic, we started to systematically monitor public decisions aimed at regulating international movement in response to the outbreak of the novel coronavirus. Examples of these decisions include the closure of national borders, mass evacuations, and quarantines. Back then, our intuition was that governments would be confronted with some sort of a trade-off. And one such trade-off, if not the most important one, is the choice between prioritizing the safety of the state's own citizens, regardless of whether they lived within the state's borders or not, or extending the protection to foreigners who are also long-term residents. The former is, if you wish, a thick conception of membership, whereas the latter is a thin one. To explore these issues, we have built an open access dataset with global coverage, and we update it daily. And now I hand over to my colleague Lorenzo Piccoli, who will give you an overview of the database and of its uses.
So my name is Lorenzo Piccoli. I work at GLOBALCIT as a research associate, and I'm also the scientific officer of the Swiss National Center of Competence for Migration and Mobility Studies. Our data set, as Jelena was saying, can be used to better understand the regulation of international movement in the context of a pandemic. It is freely accessible to the public. We try to update it every day. On the basis of a number of sources, we primarily use the information provided by the International Air Transfer Association, but we also rely on governments' websites and newspapers. The dataset documents which countries have introduced restriction to international travel. And here we see that the number of countries has been growing very quickly. We had about 60 countries in the dataset at the end of February. The number went up to 150 by the end of March already. And now we are at 165 countries at the time of speaking. We also document the type of restrictions. So initially, quarantines were quite widespread. And then in March, most of the countries switched to a ban to travel, meaning the complete prohibition to enter into the country. The dataset also tracks the targets of those restrictions. So the countries that are most affected, initially, again, the end of February, there was the case of China mainly, but also South Korea, Japan, Iran. Italy was then added to the list, and then Spain, Germany, the United Kingdom. And today the situation is actually pretty even, because most of the countries have introduced a blank travel ban for all countries worldwide. Finally, and this is most important maybe for our research, the data set also shows which countries grant exceptions in the moment when they introduce a travel ban. And what we observe is that almost all of the countries grant exceptions to their own citizens and also to long-term residents. These two categories of people are allowed to travel back home. And in a way, this is not surprising, because it's in line with international human rights standards, in particular with Article 12 of the 1966 International Covenant on Civil and Political Rights. That article says that the person should be allowed to be readmitted to his or to her own country. What is interesting for us is that most countries have interpreted that article rather extensively. So not only they allow citizens to travel back home, but they also allow residents to do the same. There are a few countries that don't do that. Those are Aruba, Fiji, Saudi Arabia, but they're really exceptional in this sense. So what we infer from the data set is that most of the countries that have introduced a travel ban still allow citizens and residents to travel back, and this is in line with the thin conception of citizenship. At the same time, as we know, it's not quite the same thing to give the right to come back and to actually make it possible for people to use that right. A number of countries, for example, Australia, most of the member states of the European Union, Israel, New Zealand, the United States, have mobilized very expensive resources like consular assistance, medical support, and charter planes to bring back their own citizens who were stranded abroad. And what is important here is that they've brought back citizens, but they have not done the same for residents. So in this sense, of course, we see a thickening of citizenship because those repatriation initiatives are based on a romanticized idea of cultural nationalism. It must be said, however, that there are a few exceptions to these. Governments like those of China, Jamaica, and Romania not only haven't really mobilized those resources, but have also asked citizens abroad not to return to the country, and they have done so primarily for health reasons. So we think that's really interesting.
Now, as you have seen, the different measures that states have implemented to limit the spread of disease show how important different conceptions of membership or the different kinds of residence and citizenship statuses can become in the context of pandemic. By observing what membership means in this borderful world, we can think of two plausible and possibly concurrent developments for the future. First, states may become more cautious about whose safety they're responsible for. As a result, they may be less inclined to hand out passports to individuals with scarcely any connection to the state. And second, states could possibly become more open about the significance of migration for their economies. Travel bans, as you know, have resulted in scarcity of seasonal and care workers all over Europe. The obvious policy response is to relax the current travel restrictions. And this has been the case with the Romanian fruit pickers in the United Kingdom. Well, hopefully, this will also change the political discourse to acknowledge that our societies are thriving on and not threatened by migration. Yet, there's a dark side to this story. Closed borders and involved states may curb the pandemic indeed, but their effect could backfire if it strengthens the grip of populist and authoritarian governments, if it increases xenophobia and discrimination. And that is a high price of a citizenship toothache. For further information on our work about the COVID-19 and its effects on citizenship, please visit globalcit.eu. Thank you.